do the exercises sitting down. If you don't feel like standing and you've had a hard day, it's absolutely fine. But I'm going to stand, and hopefully some of you are going to stand with me. I'm just going to go through a short mobility exercise, just a very short session, just so you get a taster of what we do and how low level it can actually be. And then obviously we let people just work at their own level throughout the whole of the session, and over the weeks we see the people grow in confidence and in strength and stamina. So we're going to start off with a gentle march on the spot. So we're going to pump the arms, looks like this from the side, lift the knees, feet apart. And in the chair, if it's too much to lift the knees, just tap your toes, get the blood circulating around the body. Let's just get everything moving because we just feel better. Okay, so now we're going to go into some heel digs. So right to left with the heels. Hopefully you can see what I'm doing with my feet. There we go. And a few toe taps. So this is just mobilizing the ankles, warming up the lower legs, and then to side taps. So just let your arms do what's comfortable for you. And they're pretty good for balance there. Use your arms for balance. Tapping behind. So some little taps back. Looks like this from the side. Just tapping on the toes there. And then we're going to bring it back into a march. So again, just think about your posture. So relaxing your shoulders down, looking straight ahead, drawing your abdominals in and swinging your arms. Just relax the shoulders down. Okay, so we're going to now warm up just the outs and ins. So for the hips, the inner and outer thighs. So we're going to go out, out, in. Exactly the same move in the chair. So keep the knees slightly bent as we go. Pull up nice and tall through your upper body. And we're going to step this wide. So wide march now, lifting the knees. Perfect position for some shallow squats. So we're just going to squat down and back up. Keep the knees nice and soft. Just a nice smooth movement. So you're only going as far as you're comfortable. In the chair, knee lifts, right to left if you're seated. So we're just going to go a couple more. And if it's okay and it feels okay, turn the toes out. Now, if this hurts your knees, don't do this. But this is just getting into the inner thighs and the weaker muscles there on the inside. And warms up the groin area as well. So just two more for me. And then we're going to hold it at the top. So hands on your hips. If you're on the chair, just hold on to your chair. We're going to bend down one side and then the other. So this is just warming up the waist, those postural muscles, the lower back, the lower tum. And we're going directly to the side. Just as far as is comfortable. One more each side will do nicely. And we're going to pick up a march. This time we're going to slowly roll the shoulders backwards, just because shoulders like to be worked backwards first. Just your range of movement. And sometimes this area is very delicate after surgery with breast cancer. So, you know, just take your time over the moves. So we can change direction, go forward there. So it's all about your range of movement. If the circles are too much, we just go with a shoulder raise up and down. Brilliant. Back to the march and back to outs and ins again. So we can go a little bit wider, a little bit deeper if you're feeling warmer. Just work at your own pace. We're still in the warm-up phase. This last one, hold the feet out, back into squat. So we get those hips right back, like we're sitting on a chair. And how many times a day do we do this? Quite a lot. So nice and soft on the knees. Don't lock out the joints. Get the weight right back. Keep the weight even between the feet. One more. Come to the top. Turn out the toes. We'll go again. And again, if this isn't good for you, then you just stay with the forward squats. If you're in the chair, knee lifts, right to left. Keep your back nice and strong through the movement or support at the back of the chair. So two more. Brilliant. And back to the side bend. So either holding the chair, supporting on your hips, side bends right to left, So always coming back into the center just gives you that realignment before you go off the other way. And of course, just make sure you're not holding your breath through the exercises. Get the oxygen to those working muscles. So we're going to do one more and then pick up the march again. So if you are feeling a little bit tender around that area, just a few little shoulder raises up and down. If you can, a few circles forward and a few back. And if you want to make it a little bit bigger now, we can circle round with the elbows, just a few forward and back. And if you're feeling really good in your recovery, you can go nice and big through those shoulders. It's all about how you're feeling and tailoring the move to yourself. So you're not going to keep up with anyone, just yourself. Brilliant. Give the arms a shake. We're going to come just a little bit wider on the feet. We're going to do a few heel toes. Just warms into the ankles before the main workout, just a little bit more. And the same on the other leg, heel and toe. Brilliant. And then we're just going to finish off with some neck rolls. So we're going to drop the chin down. Don't do this if you're dizzy or you've got vertigo, but we're just going to trail the chin round to one shoulder. Lift your head so it's parallel to the floor. Your chin's parallel to the floor. You're looking back as far as you can and then trailing the chin down to chest. This is just nice, just relieves a little bit of tension in your upper back and shoulder area that we sometimes get. And then back to the right side again, or whichever side you started on. Like I said, if you feel dizzy, don't do this movement. And then back into the center. Brilliant. Lift the head. And we'll do a little side stretch over. So we're just going to very gently hold the head. And the opposite hand, if you just push that away, just open up that gap between your ear and your shoulder, but very gently. You're in control of that pressure there. Just slightly turning your head on the diagonal moves the stretch around into your neck a little bit more. And then looking straight ahead. Brilliant. And then changing over. So it may be that just holding that position is enough of a stretch. Then you wouldn't take it any further. If you want a little bit more, flat hand, just pushing down, opens up the gap a little bit further between the shoulder and the ear. Slight turn on the diagonal, moves it down towards the back of the neck there. Just feels really nice. Coming back to the center, brilliant. A little bit of a chest stretch. You probably wouldn't go right into that big open movement, but it might be that you just get your patient just to squeeze the shoulders back a little bit, just to open that airway, just avoid that round posture and keep the airways open. So we're just stretching out the chest very gently. And then obviously progressing onto hands on lower back and maybe even full stretch by clasping the hands, but starting off just nice and steady. And then the top of the back, we just bring the arms in front, drop the chin forward and just push, opening the shoulder blades up and the top of the back. Feels really nice. Coming to the center, we can do some stretches, exactly the same in the chair. We can stretch the back of the thigh out for the hamstring muscle. So just leaning over that straight leg there. Feeling a stretch anywhere between your bum and your knee in that big muscle. And if you're seated, calf stretch is easily done by bringing up those toes, and we can do it standing as well. Pushing the heel down, moves below the knee, and the same on the other leg. And these stretches can be done every day if you go for a little walk, toes up, pushed out. Even if you just sat watching TV, you can do a little bit of stretching or a little bit of exercising in the chair. So we're just going to finish off with the side stretch now, which is quite nice. If you're in the chair, just support with one hand while we reach up and over. If that arm's not going to come over today, we're just going to do a little side stretch here. But if you can go over, this just nice, opens up the rib cage. And then we come back to the center. Same again, if you've got one side and you just want to take it over without the arm reach, is fine. We come back to the center and we're going to just take a couple of deep breaths in. So we bend the knees, breathe in, breathe out, little stretch up, and then shake down the hands. And one more time. Deep breath in, breathe out at the top, shake down your hands, and you can give yourselves some well-earned pats on the back.